So Ben, right now you see the news like we all do. There is just so much issues around healthcare. People are understandably upset about the quality. A lot of things going on here. How do you see the future of healthcare?
Well, I'll combine with what the future could be with what I'm purposely out advocating. so because I have spent my entire career trying to figure out how to make it better, and I think there's a way. The first thing is, and fortunately one of these, I watched Secretary Kennedy's entire Senate confirmation, all 3.5 hours of it, and he actually said one of these. So I'm hopeful that the first is, the biggest challenge, the biggest problem we have in healthcare today is multi-chronic disease, multi-chronic conditions, and catastrophic conditions. And I think most of us know what multi-chronic is. That's where you've got diabetes and heart disease, and you got a serious thing. It makes you a very complicated case for a physician, and it makes it very challenging for the healthcare system as it is today. And then the other is catastrophic, and that's where maybe you have a stroke, or maybe you have an accident, you become quadriplegic, or you lose function, and you're not coming back. So you have a lot of the same conditions as a multi-chronic, very complicated. Well, those cases today are not well served by what you said, an episodic system.
Right.
People bounce from one specialist to the other. They bounce from one situation to the other, and we do a horrible job at it. Well, guess what? It's 50% of the cost of all healthcare, 50%, and it's in 5% of the people. Now, in business, logically, if you've got a problem like that, you go to that problem and you fix that problem. Astonishingly, today, neither government nor private industry on any significant scale pays for someone to manage those cases. It's astonishing. We should instantly have companies come to mind who do that. And there's plenty of companies out there that people who have those skills who could do it. We just have to set up a system to pay them for it. So what I'd like to see is all of the chronic patients, and you can define them by diagnosis and prognosis, as you know, they move out of wherever they are being taken care of today in terms of the payment system, and that money actuarially moves with them, and we set up a system, and we go after creating providers of care who are the coordinators. They may still use their local doctors and hospitals, but you got somebody on top of it making sure it works right, and they have the AI there to help them manage their own case and track their own case. So that's one of the solutions. The other solution is that we're all walking around with our own AI Optimum Health app, and our doctors have got their own Optimum Provider app, and we're working together far more productively than we are today. I think you'll see, the other thing is I think we'll move away from fee-for-service medicine, and we will. When you move the complex care into separate management, guess what happens to insurance rates? They drop about 40 to 50%.
Can you say that again?
When you move if you separately finance, because keep in mind, actuarially, we're already paying those dollars.
Right.
But when you move it out of insurance, just move it over separately, and so now we're managing that separately and financing it separately. Insurance rates for everybody else drop about 40 to 50%.
Wow.
Now what happens is now you really are back into an episodic system.
Right.
You're paying for your primary care. You're paying for if you have to have a hip replacement. You're paying for accidents and things like that. It becomes much more affordable and much more manageable. So if you did that, you could theoretically not have any uninsured, no uncompensated care, and have no medical bankruptcies. That's what could happen. Yeah. And so that's the kind of things that I see possible. And then something that sounds small, but I think it's huge. We don't have a social contract on healthcare today. Now, what do I mean by social contract? We all know, kind of what happens on Social Security. We and our employers pay some money in, and when we retire, we get a little money there. Not probably enough to live on very well, but we can at least live. We know what happens with unemployment. If we get laid off, we know we're going to get some checks for a period of time till we can go back to work. We know military service. If I go into military service, I'll get the GI Bill, and I'll get this. I'll get veterans care for the rest of my life. Well, what is it on health care? I have no idea. I've been working in it, and neither does anybody else. And we've never had a leader, a president, or a secretary of HHS get up and say, here's the deal. And so what we assume is I can take crappy care of myself, destroy my health, be self-destructive, and all you guys will pay for it. Mm-hmm. That's not what a wise civilization does. And so what we ought to do is say, you do the best to take care of yourself. You're never going to go broke with medical bank. We're not going to let you go broke because of medicine. You take good care of yourself. That's the deal. And also, we're going to give you the tool to keep her, and that's the AI. We're going to give you all the tools to help you stay healthy. And then it's up to you.
You know, I think this is an exciting future in that one of the things that I learned, in this process was early on, I thought I needed to tell people what to do and that they would go do it. What I realized is that people don't resist change, but they resist being changed.
Yep.
And oftentimes what I may have interpreted earlier in my career as resistance was just lack of clarity. I was paternalistic. I was telling people what to do rather than collaborating with them. Number two, I really wasn't giving them clear direction. I was saying, the classic, eat less, move more, right? And which has helped nobody ever.
Right.
What you're describing is that we can give people that clear path, the data. Here's your clear path. Here's your roadmap. Here's how we're going to assess and adjust from that based on your personal preferences.
Right. And what I think we can do, I think with AI, we will be able to calculate personalized for every person. Here's what your optimum health status is. I don't care how bad your health is today, how much you've not taken care of yourself. Here's what it would look like, and here's how you get there, and here's what you need to do today. Then if you choose not to do it, okay, you're free will, you get to do it, but at least you'll know. And we do know that, I know from probably one of the things that my son Hugh and I helped take national was a wonderful product invented by a lady here in the Valley named Mary Swanson called Silver Sneakers, which is, I think, today the largest health exercise program in the United States, average age 78. And that was really saying to a group of people that had been neglected, nobody thought they would go to gyms, nobody thought they'd exercise. We just said, here it is. And that was 15% of the population. Well, we can guarantee you 15% of the population is going to use the heck out of this app. The others will follow slower, but I've had the pleasure of watching over the last 30 years when we think everybody's really doing bad. I've watched going from almost no gyms to one on every corner, and they're full.
Right.
And how many programs we see, diet, exercise, people are paying more attention. So this is a timely thing, and I think something like this Optimum Health app can be what really changes the world.
So interesting how it all comes back to potentialists again, is it? And it's something I've recognized in my practice is that people who come in with a diagnosis, a high calcium score, a recent heart attack, and they've lost hope. They're like, well, it doesn't matter what I do now because there's not. And then I can show them that future, at least through my words. I can even imagine if you could show them more tangibly what that future could be. And they walk out and say, okay, now I have hope. Now what I eat is important to me. Now what I'm doing is important to me.
Absolutely.
That's powerful.